pick a brief update on bioavailability and also covering absorption. So what is bioavailability? And the abbreviation for bioavailability is in fact F, because bioavailability represents the fraction of the administered dose of the drug which reaches the systemic circulation. And it's the fraction compared to the intravenous dose where 100% of the drug makes it into the systemic circulation. So it's usually calculated as the area under the curve of the route you're giving, which might be oral or intranasal or subcutaneous, compared to the intravenous route. And so generally speaking, this value tends to be lower than this value, or it tends to be the same. And so you get a value that's a fraction or something less than 100%. So for example, if your total exposure is 20 milligram hours per liter orally, and it's 100 milligram hours per liter intravenously, then your bioavailability is set to be 20%. And with oral medications, there's two important parts of the process. There's firstly absorption, and then there's first pass metabolism past the liver. And what about the subcutaneous, intramuscular, and other routes? Well, it depends very, very much on other routes. So you might expect subcutaneous and intramuscular to have 100% bioavailability, but in fact, many times they don't. And that's because in the process of making their way from the muscle or the fatty tissue into the systemic circulation, which is plasma, then the drug can also be absorbed, metabolized, and other things can occur in the process. With many medications which are inhaled or administered topically, for example, in the nose or the eyes, in fact, the vast majority of what makes it into the systemic circulation is what is swallowed and absorbed through the oral route. So why is bioavailability important? Well, in clinical trials, the vast majority of the medications we give are administered orally, and low oral bioavailability is a major issue for the further development of the drug. It might mean, in fact, that you need to reformulate the drug into some of the formulation to try and improve its oral bioavailability, and we'll see why shortly. With local administration, so for example, skin or inhaled or nasal, then low bioavailability means that little of the drug gets into the systemic circulation, so you can actually avoid systemic adverse effects. So there it's actually important to have as low bioavailability as possible. In clinical practice, it determines the routes that the drug can be given. So this is important where, for example, drugs such as gentamicin can't be given orally because they're simply not absorbed. Other medications such as vancomycin can be given orally for pseudomembranous colitis, but if you want a systemic effect, then they really have to be administered intravenously. Low bioavailability can also mean get a lot of variation in the drug concentration. So medications that tend to have low oral bioavailability, you tend to find that their effect tends to vary quite a bit between different individuals, and can also determine the difference in the dose from the oral to the IV route. So we think about a drug like verapamil. In the emergency setting where we might give it intravenously, then the dose given is say 2.5 to 5 milligrams. Whereas the same dose orally as an immediate release formulation is about 80 milligrams. That's because it has quite poor oral bioavailability and a high first pass metabolism. Now the classic example is morphine, where once again it has high hepatic first pass metabolism and as a result low oral bioavailability. And so if you're giving an oral dose compared to a subcutaneous dose, then generally speaking the oral dose is about 3 times the parenteral dose. So when we're talking about oral absorption, this is the process of getting the drug into the body. So from the lumen of the gastrointestinal tract into the body. So not necessarily the bloodstream at this stage. So for oral administration, then the drug has to firstly disintegrate. So if it's in a solid dose, such as a tablet, it has to disintegrate into many particles. Then it has to dissolve. And this favors water-soluble hydrophilic drugs because they dissolve obviously more readily in the gastric juices. And then it has to survive being degraded by the acid in the stomach as well as the enzymes in the gut. And this essentially rules out many proteins. And then it has to cross the intestinal epithelium. So in the stomach, there's actually not a lot of surface area for it to be absorbed, and so most drugs are absorbed in the small intestine. So unfortunately, at this point, only lipophilic drugs cross the cell membranes. Well, some hydrophilic drugs can also pass between cells, and the molecule has to be not too big. It has to have roughly the right sort of pH and be of the right size. It has to not get pumped out of the intestinal cells back into the gut lumen. Sometimes there's active transport for some drugs and substances, such as iron and L-DOPA, which helps it cross the intestinal epithelium. And finally, the colon is not as good at absorption because it has a smaller surface area and has tight junctions between cells. So hopefully, as you can appreciate, the actual process of absorbing drugs is a bit complicated, and so not every drug, in fact, gets absorbed very readily. One of the things we alluded to in the last slide was about drugs being pumped out of intestinal cells, and that's done through an enzyme called G-glycoprotein. So if you imagine here that we have intestinal cells here, we have the intestinal lumen out here, and blood vessels here. And this is, for example, a villus all the way around there. Then pglycoprotein is a efflux pump that sits here on the surface of cells and pumps drugs which sit inside the cell out into the lumen. And so as a result affects the bioavailability of drugs because it's one of the factors that contributes towards drugs not being absorbed. As soon as they're absorbed into the cell, then in fact pglycoprotein then spits them back out again. Now, it has some degree of saturability. So the effect may be seen at low doses of the medication, but in fact at high doses you can actually overwhelm this pump and it tends to have less of a proportionate effect, and we'll see an example of this shortly. So to summarize absorption and bioavailability. So bioavailability is a fraction of the drug which makes it into the systemic circulation. For oral administration, it requires two processes. One is absorption, and the second one is first pass metabolism past the liver. For other routes, it depends on a large number of different factors, particularly to do with that route. In clinical trials, it's important because ideally you want high and reliable bioavailability for orally administered drugs, and low and variable bioavailability is bad for further drug development. For topical administrations, such as putting it on the skin or administering it in the eyes or the ears, then the bioavailability determines the systemic exposure, which generally is related to systemic adverse effects. The good news about the cup of coffee you're having is that caffeine tends to have nearly 100% bioavailability with oral absorption. So all the things we talked about don't really apply.